Today in Williamson County EMS Medic CE, we're going to be talking about endocrine and metabolic emergencies. This is kind of reinforce some of the things that have been taught in AMLS and to talk about some of the calls that you don't normally encounter, so it's good to review these types of things.
You can pause it.
The endocrine system is made up of 7 main glands: pituitary, thyroid, parathyroid, adrenal, pancreas, and the reproductive organs, testes and ovaries. For the purpose of today's lecture, we're going to focus primarily on the first 4. The first gland to talk about is the parathyroid gland. This lies posterior to the thyroid gland. The chief cells responsible for production of parathyroid hormone, or PTH. These stimulate production of vitamin D in the kidneys, encourages reabsorption of calcium by renal tubules, inhibits phosphate reabsorption in kidneys, and liberates calcium from bone to increase calcium levels. So the 2 primary concerns with a person that's suffering from hypoparathyroidism is going to be vitamin D deficiency and hypocalcemia, and we'll talk about that next. Hypoparathyroidism. It's a rare condition characterized by low serum levels of PTH. The most common effect is going to be hypocalcemia. It is possible to see on an EKG hypocalcemia, and it manifests itself as a prolonged QT interval. Normal QT interval is going to be less or equal to 0.4 seconds. So if you see a QT interval longer than 0.4 seconds, this might be a cause for suspicion. Signs and symptoms of hypocalcemia include muscle spasms, paresthesia, which is numbness, tingling, prickling of the skin, and tetany, involuntary muscle contractions or spasms. Diagnosis of hypoparathyroidism. Recent neck surgery, Trossos sign. The way to accomplish this is inflate the blood pressure cuff on the patient to 30 millimeters of mercury above the patient's systolic BP. Hold in place for 3 minutes. The test will be positive if results are muscle spasms of the hand or forearm. A second field test is chopstick sign. Tap the facial nerve against the mandibular bone just anterior to the ear. The test will be positive if this causes facial muscles to spasms. Patients will also take certain types of medication which will be helpful in the diagnosis of hypoparathyroidism. They'll be taking calcium and phosphorus and may be taking vitamin D supplements as well. Next, we're going to talk about the thyroid gland. The thyroid gland lies in the anterior part of the neck below the larynx. Hyperthyroidism. Common ailment that results in hypermetabolic state known as thyrotoxicosis. Thyroid storm, a rare complication that occurs in 1 to 2% of patients. Life-threatening condition characterized by hemodynamic instability, altered mentation, GI dysfunction, and fever. Graves' disease, also known as diffuse toxic goiter, and your patient may complain of having one, if not both of these, as a medical history. This is an autoimmune disorder in which antibodies mimic the role of TSH, resulting in increase in secretion of thyroid hormones. Common in middle-aged women. Hyperthyroidism signs and symptoms include apprehension, agitation, edginess and shaking, heart palpitations, weight loss up to 40 pounds over just a short time with increased appetite, heat intolerance, increased sweating or complaining that it's really hot when it's not, enlarged thyroid gland, polyuria, polydipsia, and hyperglycemia. In terms of patient medications for hyperthyroidism treatment, the patient may be taking tapazole, and they may also have recently stopped taking a beta blocker per their doctor's orders, which may have led to the presentation of signs and symptoms. Physical signs of hyperthyroidism are going to include an enlarged thyroid gland, as seen here. The research I did for these pictures also showed several patients with not as pronounced enlarged thyroid, so by all means, if you see your patient with the previously mentioned signs and symptoms, a quick palpation of the neck may clue you into what's actually going on. Thyrotoxic gaze is another physical sign of hyperthyroidism, a wide-eyed staring gaze and overaccumulation of loose connective tissue behind the eyeballs. That one I don't think you can miss. There are several triggers of hyperthyroidism: infectious disease, cardiac ischemia, serious burns, thromboembolism, major surgery, trauma, hypoglycemia, diabetic ketoacidosis, and the non-ketotic hyperosmolar state. So a patient with a diabetic history has already got precursors in place for this, as well as patients with cardiac disease and trauma and/or major surgery, especially to the neck area. Quick word of caution for patients with known hyperthyroidism. Use the following medications with caution. First, amiodarone. This can result in thyroid storm with associated cardiac decompensation secondary to being extremely rich in iodine. Second, aspirin is associated with decreased protein binding of thyroid hormones and can exacerbate symptoms. Third, which is not really our problem but something to mention at the hospital, is iodine therapy. Hypothyroidism. This is actually a more common illness than we realize when we look at our patient medications and patient history. It's decreased or absent secretion of thyroid hormones, occurs in 5.8% of the population, most common in Caucasian females between ages 40 and 50. Patients are prescribed typically Synthroid and levothyroxine. History for this is going to be recent surgery or radioablation therapy and an autoimmune disorder. The signs and symptoms of hypothyroidism include skin will be cool, dry, yellow, and coarse, thinning eyebrows, coarse hair, intolerant to cold, which is going to be the opposite of hyperthyroidism, and neurological changes such as altered mentation, ataxia, which is a lack of coordination, and prolonged deep tendon reflexes. For those of you that remember when Dr. Benold talked about deep tendon reflexes in a lecture, this is why. The hypothyroidism physical appearance. You'll notice this extra tissue around the face, puffy cheeks, the thinning of the hair, and the droopy eyelids. Now that's the patient on the left. The patient on the right, same patient, but this is after treatment with typical medications, and you see the improvement in the patient appearance. A complication of hypothyroidism is myxedemia coma. Hypothyroidism becomes chronic and extreme. This results in the patient having hypotension, bradycardia, hypoglycemia, and hyponatremia. The adrenal gland. The cortex or the surface of the adrenal gland secretes glucocorticoids such as cortisol, secretes mineralocorticoids such as aldosterone. The medulla secretes epinephrine and norepinephrine. The hypothalamus of the adrenal gland secretes corticotropin releasing factor, or CRF. This stimulates the pituitary to produce adrenocorticotropin hormone, ACTH, and melanocyte stimulating hormone, MSH. Adrenal gland reacts by secreting cortisol and aldosterone. Cortisol, released in response to stress and low blood glucose levels, and aldosterone plays a central role in the regulation of blood pressure as part of the renin-angiotensin-aldosterone system. Chronic adrenal insufficiency. This is going to be inadequate production of cortisol. Primary insufficiency is known as Addison's disease, caused by direct insult to the adrenal cortex. Signs and symptoms of this include chronic fatigue and weakness, loss of appetite with associated weight loss, hyperpigmentation of skin and mucous membranes. This is an example of hyperpigmentation. You'll notice what looks almost like a rash on the patient's face and back. Now make sure you're not looking at allergic reaction. If you see a patient like this, I would rule that out first and then go on to the Addison's disease diagnosis. Other signs and symptoms of adrenal insufficiency include hyponatremia, hyperkalemia, hypotension, and GI disturbances, abdominal pain, nausea, emesis, and diarrhea. Now, abdominal pain with nausea, emesis, and diarrhea, we're always thinking stomach bug, flu bug, things like this, but delve a little bit deeper into your patient history and make sure you're not overlooking something to do with adrenal insufficiency. Hyperkalemia. On the ECG, this is actually pretty easy to see. If you'll notice across the board in all leads, extremely peaked T waves. This is early hyperkalemia. As it progresses, the T waves will actually begin to flatten out and the QRS widens out considerably. So this is early stage hyperkalemia. Common prescription medications for Addison's disease and adrenal insufficiency include oral corticosteroids, cortisone, prednisone, and I'm not even going to try to pronounce the top two, so have at it. Patients may be on an increased amount of sodium in their diet as well, per their doctor. Hyperadrenalism, also known as Cushing syndrome, clinical condition caused by long-standing exposure to excessive circulating serum levels of glucocorticoids, particularly cortisol, as a result of overproduction of the adrenal cortex. This could be from chronic corticosteroid use, adrenal gland or pituitary gland tumor. Signs and symptoms of Cushing syndrome include central obesity, moon face, increased body or facial hair, a fatty buffalo hump at the back of the neck, atrophied proximal muscles, and thin and fragile skin. This concludes our short and hopefully painless presentation on the endocrine system. There will be a short quiz to follow. And this is my first time, so if you have any comments or suggestions, please email them to me at rcummins@wilco.org. Thank you for your kind attention.